Hello, everyone, and thank you for joining us today. Welcome to NCSL's webinar on maintaining child vaccination rates during a pandemic. My name is Tara Johnson, and I will be moderating the webinar today. I direct our public health and maternal and child health work here in NCSL's health program. Before we start, I want to make a note that there were a few last-minute edits to the slides. If you logged in before quarter of, you may not see those edits. I believe there were only about 5 or 6 early birds, but if you're one of them, I suggest logging out and logging back in to ensure that you have the latest set of slides. Thank you. As many of you know, the spread of coronavirus continues to be a top concern for Americans, federal, state, and local government, and increasingly state lawmakers. Policymakers are taking extra steps to respond to and anticipate impacts of the virus. NCSL is committed to providing our members with timely responses to state research requests and the essential knowledge needed to guide state action. This webinar is intended to educate state lawmakers and legislative staff on recent data related to childhood vaccination coverage and state efforts around childhood immunization. Over the next 60 minutes, we encourage participation through polling and through the question and answer box. Please submit any questions that you have throughout the webinar in the box on the left-hand side of your screen. I want to briefly mention the resources. Above the presentation, you will see tabs with one of them labeled Resources. Here you can find and download a PDF version of the PowerPoint, resources from the Centers for Disease Control and Prevention, as well as you may find several resources NCSL staff put together for you. Another tab is labeled Speaker, where you can find and read the bios of today's speakers. You can access these tabs during any time of this presentation. Today's webinar is being recorded and will be available on NCSL's website within the week. NCSL is a bipartisan organization that serves the legislators and legislative staff of the states, commonwealths, and territories. NCSL provides research, technical assistance, and opportunities for policymakers to exchange ideas on the most pressing state issues, and is an effective and respected advocate for the interests of the states in the American federal system. NCSL does not advocate for specific policies, nor do we take positions on state issues. This webinar is a platform for information exchange, and we hope that this webinar will answer questions that you may have and share several state examples. NCSL developed a webpage to house our comprehensive resources on the state and federal response to COVID-19. Here you can find information on state policies and response related to the continuity of government, education, fiscal, elections, criminal justice, and other important considerations. Today, we have 3 very knowledgeable speakers who will share their expertise with us. Please remember to click on the speaker bio or the speaker tab to read their bios. First, we'll hear from Dr. Melinda Wharton, who will provide an overview of the most recent data from the CDC around COVID-19's impact on children's vaccination rates. Then we'll hear from Claire Hannon, who will share several state initiatives around maintaining or improving vaccination rates to get to a safe level of immunization in the states. Last, we will hear from NCSL expert Eric Skinner, who will provide a brief overview and examples of enacted legislation over the last year or so. Momentarily, you will see a poll show up on your screen. We'd like to get a sense of where everyone is calling in from today. Please select the region that you're joining us from. I understand that some states overlap regions, so just pick whatever region feels best to you. While you are selecting your answers, I would like to take a moment to thank the Centers for Disease Control and Prevention for their support of this webinar. CDC support allows us to provide up-to-date and relevant educational resources for state legislatures. Okay, as the poll results are coming in, it looks like we have folks calling in from all of the regions all over the country. Great, and it looks like the most folks on the call are from the Western region. Thank you all for participating in that survey. Okay, now I'd like to introduce our first speaker, Dr. Melinda Wharton. Director of the Immunization Services Division at the Centers for Disease Control and Prevention. She will provide a national overview and update on COVID-19's impact on children's vaccination rates. Welcome, Dr. Wharton.
Thank you so much, and I'm really pleased to have a chance to talk to you all today about this important topic. With the declaration of national emergency and limitations of movement in the United States with stay-at-home orders in many parts of the country, there was a precipitous fall in outpatient medical visits in the United States, as illustrated on the line graph here. Now, as some of those stay-at-home orders have been eased, and some communities have reopened and made sure that healthcare was available and safe, there has been some rebound, but overall the level is still substantially lower than baseline. Looking back to that early period when ambulatory visits were so seriously impacted, if we look at visits by specialty, we can see that pediatrics was actually one of the most hard-hit specialties during that early period. Fortunately, since early April, there has been some evidence of rebound that the level of visits, at least as of early May, was still substantially below baseline. The number of pediatric visits was the highest among children under 2 years of age and was lowest among children 3 to 5 years of age. At the same time, we saw this reduction in ambulatory care visits. We also saw a very dramatic reduction in doses of vaccine ordered through our federal Vaccines for Children program. This slide shows doses ordered by week for 2019 in the blue bars and for 2020 in the orange bars. And you can see in the most recent period, illustrated towards the right side of the graph, that each week the number of doses of vaccine ordered by participating VFC providers was substantially lower than it had been during the same week the year before. And this reflected the reduction in outpatient visits and vaccines being delivered within the healthcare system. The previous slide was for all non-flu vaccines. This is for measles-containing vaccines specifically. And measles vaccines are given during the second year of life and then most commonly around the time of school entry. So it's not a vaccine that's given to the youngest children. And comparing this to the previous slide, the reductions are actually even a little bit more dramatic than they were for vaccines generally. At the same time this was happening, I expect you all are well aware of this, that primary care from a business perspective was really adversely impacted. The initial funding for the Provider Relief Fund was really focused on providers who participated in Medicare, and so pediatricians and family physicians who didn't take care of Medicare patients were left out of those initial rounds of funding. And one of the results of the absence of additional support, as well as this very dramatic fall off in visits, was a very serious impact from a business perspective on these practices. And at least some of them have, at least a few practices have closed permanently. And earlier on, we were very concerned about how many practices would actually make it through this very difficult period. So in response to these findings, we've undertaken a number of activities at CDC. First, we're monitoring vaccine service delivery to inform our interventions. We're providing support to providers through the development of guidance and support materials, supporting catch-up vaccination through reminder recall systems, assuring access to vaccine by identifying gaps in our Vaccines for Children provider network, as well as increasing support for VFC vaccine purchase and operations through our usual budget process, as well as being on the lookout for policy interventions to support healthcare providers. We're working with partners to communicate the importance of vaccination, particularly to parents, so that they know that they really do need to get their child in for those well child visits, as well as trying to get information on the Vaccines for Children program to families who may be newly eligible for the program. And then, of course, there's very important back-to-school vaccination activities that need to be undertaken during the summer, and right after that, influenza vaccination in the fall. So it's going to be a really busy rest of the year for providers who vaccinate patients as well as health departments. In terms of supporting healthcare providers who deliver childhood vaccines, we were really pleased to hear that as of June 9th, there is financial support available through the Provider Relief Fund for Medicaid and CHIP providers, and really appreciate that our colleagues at HHS have made this happen. It was complicated and it took a while, but they were able to do it, and that's a really big, important step. We've also been working to promote catch-up vaccination with reminder recall, and have refocused our immunization program quality improvement activities to focus on catch-up vaccination. And we've developed and disseminated guidance on safe delivery of vaccines during the COVID-19 pandemic, so that providers have good information on how to safely deliver vaccines. That guidance really identifies vaccination as an essential medical service for all children and adolescents, which ideally is delivered in the medical home. We recommend that all due or overdue vaccines be given according to the routine immunization schedule during the same visit. We've recommended strategies to catch up patients on vaccines, starting with newborns, infants, and children up to age 24 months, and then extending to young children and adolescents, and provided guidance on safe delivery of vaccines, including use of personal protective equipment and social distancing. The communication activities are really important because probably the largest part of this reduction in outpatient visits was actually not so much that offices were closed, but that parents were keeping their children at home. So we've undertaken communication activities to encourage parents to contact their pediatrician, to return for well child visits, for providers to use reminder recall to get children up to date as quickly as possible, and that providers can discuss the safety protocols they put in place to ensure that their patients can be safely vaccinated. And providers really have been very quickly were able to make changes in their practice so that they were able to do this safely for the families in their practices. Also, with some of the rise in unemployment, with many people having lost their jobs, there may be newly uninsured families who are eligible for the Vaccines for Children program that don't know about that program, so we're trying to get the word out about it. Before the pandemic, about half of U.S. children were eligible to receive vaccines purchased by the federal government through the Vaccines for Children program, and that number may be greater now due to recent loss of jobs or insurance coverage. Parents of newly eligible children may not be aware of the program, and partners and providers can help improve vaccine access by increasing awareness and enrollment in the VFC program. We've also developed a number of communication resources that can help for communication with parents about the importance of routine vaccination during the COVID-19 pandemic. And the American Academy of Pediatrics has done a wonderful and very creative campaign on social media using the hashtag #CallYourPediatrician that really has highlighted in a kind of lighthearted way the necessity of getting your child back in for well child visits and immunization. Fortunately, we are seeing some evidence of recovery when we look at our most recent ordering data. Again, this slide is similar to the previous one with the week-by-week comparison. And if we look at the last few weeks, we can see that it's much closer to last year's number of doses ordered by week than it had been a couple of months ago. So we do think things are moving in the right direction based on our ordering data. School vaccination requirements really do provide a critical checkpoint for children's vaccination status, and many children will need to receive vaccines during the summer to stay up to date and to be in compliance with school requirements. That's part of the reason we're highlighting the importance of back-to-school vaccination efforts because children really do need those opportunities to get up to date and stay in compliance. Given the uncertainty about what will be happening in the U.S. this summer regarding COVID-19, it is possible there may be communities where there are challenges with all children receiving needed vaccines. And rather than waiving school requirements generally or putting families in a position where their child might have to miss school, it seems like a better solution might be to extend provisional enrollment or grace periods. But of course, we really want kids to be vaccinated, and we want to avoid the situation by having back-to-school vaccination take place during the summer in as normal a way as possible. I want to just close with a couple of slides about influenza. Every influenza year is a little bit different. This year, we actually had two overlapping waves of activity. The first one caused by influenza B, and the second one by influenza A, H1N1. It was a relatively serious year for pediatric deaths in the United States, with higher case counts than we've seen in most years. With as of last week, 185 pediatric deaths reported. And also on the slide are the most recent influenza burden estimates for the last season, with millions of influenza illnesses and medical visits, hundreds of thousands of hospitalizations, and tens of thousands of deaths. And so influenza always causes morbidity and mortality, and last year was no exception. Of course, what we're really concerned about is co-circulation during the fall of influenza and SARS-CoV-2, the virus which causes COVID-19. And so we think it's especially important that we do what we can to increase influenza vaccination coverage to decrease stress on the healthcare system. This can help decrease doctor visits and hospitalizations, as well as decreasing the number of people who need to get worked up for febrile respiratory illness, which might be flu, might be COVID-19. It seems like it's also particularly important to focus on adults who are at higher risk from COVID-19, as staff and residents of long-term care facilities, adults with underlying illnesses, African American population, and adults who are part of critical infrastructure, all of whom have had higher risk due to in the current pandemic. In our planning for the upcoming influenza season, we've been in touch with the manufacturers and have really tried to maximize the available vaccine supply. We expect to have more than 180 million doses available for the U.S. market, which, if you look at the figure on the slide, is actually more than we've had in any previous year. So hopefully every every available dose will get used and help protect our population from influenza. We do plan outreach to those at higher risk. We're planning for the potential need for social distancing in vaccine programs, and it's very important that the influenza vaccine season be seen as a season that extends past Thanksgiving into December or later, because we know that some of these 180 million doses of vaccine are not going to be available till then. So it's important that we continue vaccinating until all of our supply is released and used. And of course, we're working on communication efforts aligning with COVID-19 messaging, as well as working on messaging for African American and Hispanic communities, which historically have had lower vaccination rates than the white communities. So to wrap up, we've seen substantial disruptions in routine childhood vaccination services during the COVID-19 pandemic, although there are signs of recovery now being seen. Catch-up for childhood vaccination needs to be undertaken now so that our clinical capacity can be directed to back-to-school vaccination this summer and influenza vaccination in the fall. Immunization programs, partners, and providers can help get childhood vaccination back on track by supporting catch-up vaccination efforts and communicating with parents about safe vaccination during the pandemic. And with that, I'll close and turn the microphone back to Tara.
Excellent. Thank you, Dr. Wharton, for such a great presentation and for sharing the most recent data that CDC has on this issue. We are collecting questions as they come in for the Q&A period at the end. One question is a clarifying question, Dr. Wharton, so I'm hoping if you wouldn't mind just taking this question now. The question is, what does align with COVID-19 messaging mean in this context?
Yeah, thanks for that question. So there will be a lot of communication to providers and the public about COVID-19 in terms of things people can do to protect themselves and their families. And one of the things that people can and should do this fall is to get an influenza vaccine. So it's really including that vaccination recommendation along with other public health recommendations as the season continues.
Great, thank you so much. And as a reminder, again, we are compiling questions at the end, so please feel free to put your questions in the Q&A box as the speakers are doing their presentations. Our next presenter is Claire Hannon. She's the Executive Director for the Association of Immunization Managers. Claire will share several state efforts around maintaining a safe level of immunization. Welcome, Claire.
Thank you. Good afternoon, everyone, and thank you for the opportunity to talk with you today. The Association of Immunization Managers is a nonprofit professional membership association formed in 1999 by immunization program managers seeking to build a peer forum to share and learn from each other. The members of AIM are the immunization program managers in localities that receive federal immunization grant funding. There are 64, 50 states, 8 territories or federated states, and 6 large cities. Since you all are largely an audience of state legislators with some territories as well, I'm going to focus on state health agency activities. But for the record, there are also 6 large cities. Immunization program managers are in charge of public health immunization activities in their respective state, territory, or city. They're government employees. They work for the state public health agencies. And states receive funding from the Centers for Disease Control and Prevention to assure high immunization coverage rates in the state's population. These programs range in staff from a low of 5 employees in small states or territories to more than 100 in larger states. Immunization program activities include investigating and controlling outbreaks, using immunization information systems, or IIS, to track vaccines and identify areas of low vaccination coverage, providing safety net vaccines at local health departments, working with schools and daycares to enforce vaccine entry requirements, and a host of other activities. One of their primary responsibilities is to oversee and administer the Vaccines for Children program, the federal entitlement program that provides vaccine for eligible children. This involves enrolling pediatricians and local health departments and other providers into the program, training them, conducting site visits to assure proper storage and handling of vaccine, and assuring compliance with VFC procedures. I want to give you some perspective on the challenges and priorities of state immunization programs before coronavirus. So AIM conducts an annual survey of immunization programs to identify challenges, priorities, funding, staffing, and other trends. In 2019, 53 of the 64 programs responded. 37 of 53 responding programs listed vaccine hesitancy as a top challenge. 37 programs were involved in managing outbreaks. 31 of 53 experienced hiring delays, and 18 reported that they were currently replacing or planning to replace or upgrade aging IIS technology. The IIS not only tracks vaccine doses administered, but it's also used to enroll providers, to approve vaccine orders, to manage inventory, and support a host of other critical program activities. We asked immunization programs to give us their top priorities. Tied for number one is meeting the IIS functional standards set by CDC and the immunization community. Investing in technology is a top priority for programs. Also tied for number one is identifying and addressing low vaccination coverage rate areas for children. Programs use their IIS to identify communities or populations with lower coverage and target outreach and education in those communities to increase rates. And the third top priority, responding to and preparing for outbreaks. Just a reminder, this survey was conducted before coronavirus. In the past several years, states have been addressing outbreaks of measles, mumps, hepatitis A, meningitis, and pertussis. Since the outbreak of coronavirus, immunization program staff have been detailed to assist with COVID-19 response, including contact tracing, testing, and communication. As the pandemic continues, immunization programs are focusing activities in three areas: maintaining routine immunization, preparing for flu season, and preparing for a COVID-19 vaccine campaign. Dr. Wharton provided a comprehensive look at the drop in routine vaccination since the start of the coronavirus pandemic, and she discussed the importance of getting childhood vaccination efforts back on track. I want to provide you with some examples of program activities in the states in the four areas that Dr. Wharton mentioned. First, monitoring vaccine service delivery to target interventions. Second, supporting providers with guidance and tools. Third, communicating the importance of vaccination and encouraging parents and providers to get caught up. And fourth, planning back-to-school activities and influenza vaccination in the fall. So first, monitoring vaccine delivery. States are monitoring the vaccine delivery in several different ways and sharing this information with the public, providers, and the media. This slide shows North Dakota's tracking of doses ordered in the first 5 months of 2020 compared with the same period in 2019. And you can see a decrease of 17% in vaccine doses ordered. This chart from Iowa compares doses administered month by month in 2018, 2019, and 2020. This chart is focusing on infants 2 years of age and younger. Again, you can see the decrease in 2020. This analysis of doses administered also shows the critical value of having the IIS, the immunization information systems. This is yet another analysis from Maryland showing doses administered by age in April 2019 compared to April 2020, and you can see the sharp decreases. When you look at the data by age, you can see that the drop in doses administered is higher for older children than infants. This shows the importance of making sure vaccination of school-age children gets back on track before schools reopen. While at least 2 states, Georgia and Virginia, are delaying implementation of new school requirements for high schoolers, 2 other states with new requirements, Hawaii and Washington State, are moving forward with implementation in 2020. As Dr. Wharton said, school requirements are a critical tool to ensure up-to-date vaccination and prevent any potential for disease transmission or outbreaks. Another important monitoring activity is surveying providers. Many states are conducting surveys of providers to identify providers who might be closed or not vaccinating, or who might have capacity to take on additional patients. As Dr. Wharton mentioned, primary care providers have struggled during the pandemic. These providers, especially those in rural areas, are critical to the immunization infrastructure, and we need to make sure we're understanding their challenges and offering support. It's also important to develop messaging that maintains public trust. We don't want to be encouraging parents to get their children vaccinated when providers in their area may be short-staffed or open with limited hours. Next, support for providers. Supporting providers is critical if we're going to get caught up with the childhood vaccination so that schools can reopen, providers can regain their financial stability, and communities can be protected from routine vaccine-preventable diseases such as measles. Dr. Wharton mentioned the CDC guidance. Many states are also providing guidance to providers. This is an example of guidance given to providers in Tennessee, reminding providers that childhood immunizations are critical and providing strategies to vaccinate during the pandemic. So some strategies are for providers separating well-child visits from sick patients, conducting virtual check-ins so that no time is spent in the waiting room, providing telehealth discussions while giving curbside vaccinations, and vaccinating with the appropriate personal protective equipment and masks. Another important strategy to support providers to identify children who may have missed a vaccination or who are due for vaccination, called Reminder Recall. Reminder Recall involves analysis of IIS data to identify children who are due or overdue for vaccine. This can be done centrally by the state health agency, or the health agency can support this activity at the provider or practice level. This is an example of Reminder Recall postcard for teens in Louisiana. The postcard is targeted to households of teens due for vaccination and encourages patients to take action to check the IIS for their child's record and to contact their provider to schedule an appointment. This is another example of Reminder Recall in Idaho. This campaign focuses on the importance of vaccinating children in order to protect the community. It's building on the "we're all in this together" approach to the pandemic. Third, communicating with parents and providers as well, but communication to parents, providers, and community partners is more important now than ever. Social distancing can leave many parents wondering what they should do, wondering if it's better to keep their children at home or take their children for a well-child visit or annual physical. This is a social media campaign from Washington State. Stay safe, stay healthy, stay vaccinating. Letting parents know it's okay and they should take their children for well-child visits with vaccinations. This is another example of a media campaign from Louisiana. Washing your hands and social distancing help prevent COVID-19, just like routine immunizations help prevent many other dangerous illnesses. And finally, planning for fall. As Dr. Wharton mentioned, planning for flu season is another key activity, as well as back-to-school events in the summer. Immunization programs are increasing efforts to get flu vaccine into more people, especially adults at high risk this fall. Reducing hospitalization and doctor visits due to influenza will prevent severe stress to the healthcare system. Flu vaccination will also be a key part of keeping the economy open and keeping schools open. Here are some of the strategies that immunization programs are planning. Conducting school-located vaccination clinics and mass vaccination clinics, using schools, parking lots, testing sites, and other locations. Purchasing additional flu vaccine to assure a safety net. Targeting healthcare workers, staff in long-term care facilities, and adults at higher risk for complications, such as those with underlying health conditions, and also those hardest hit by COVID-19. Working with federally qualified health centers, community health centers, and rural health clinics, and partnering with pharmacies, doctors, insurers, hospitals, medical societies, schools, businesses. In short, more effort and more involvement by public health than ever before. This slide shows the breadth of activities going on at the state level to address the drop in routine childhood vaccinations. This was a quick poll we did last week of states, and we received 40 responses. The states were asked to check all of the activities they're engaged in. The top activities we've already talked about: communication with providers, working with partners, conducting provider surveys, and communication targeting parents and consumers. Several of the next most common activities involve increasing the number of places where a vaccine is available. So increasing vaccination services at community health centers, rural health clinics, FQHCs, local health departments. And as we move into the summer and prepare for back-to-school campaigns, using mobile vans or traveling strike teams, and holding larger clinics to vaccinate children. There are a few states looking into a potential increase in vaccine administration fees or other incentives for providers, and I hope this will become more widespread. Providers are not able to see as many patients due to social distancing, and when they do vaccinate, they are taking more precautions with PPE, face guards, masks, and other actions. These are adding costs to their vaccination practices, and we've already seen from Dr. Wharton the struggle that they are having financially during the pandemic. So an increase in administrative fees is needed. We also see just a few states looking at changing policy to allow additional vaccinators such as pharmacies. I think this is a reflection of the value of the medical home, and most programs, all programs really committed to keeping those children in their medical home. And finally, we have 2 states reporting a delay or other revision to school and daycare requirements. Again, this is only 2. I mentioned this earlier, and I think this low number really reflects the program manager's strong desire to get kids caught up before school reopens, and the real commitment to school vaccination requirements and keeping them in place. So my key takeaways for you: immunization programs are working to increase routine vaccination and catch up kids who have fallen behind. School requirements, reminder recall, communication campaigns are all playing a key role. Immunization information systems, or the IIS, and partnership with providers, coalitions, healthcare systems, and other communities are critical in this effort. Options for legislators: I want to finish by encouraging you to support immunization. As leaders, your support and encouragement of vaccination goes a long way. Always use credible resources when looking for information, such as CDC, the American Academy of Pediatrics, your own doctor or provider, and of course your state health agency. Remember that vaccination is the norm. Sometimes you may hear from constituents or groups who oppose vaccination more frequently or loudly, but the majority of Americans do choose to protect themselves and their children with vaccines. Work in partnership with health agencies. Learn about their specific challenges, activities, and goals. Before you introduce legislation, talk with the health agency about its impact. And continue to invest in public health. State public health agencies need the best science, technology, and data. They need a strong workforce of dedicated, experienced staff and leadership, and this requires investment. So thank you very much for the opportunity to speak with you, and I will turn it back over to Tara.
Excellent. Thank you so much for your informative presentation, Claire. There were a lot of great state examples on there. Very interesting. Thank you so much. For the participants, you will see a poll come up on your screen shortly. This is to tee up our next presenter. Please select one of the options on the types of bills that you are seeing in your state addressing vaccines for children. And I want to put a plug in for our maternal and child health legislation tracking database, which tracks all enacted state legislation around childhood vaccination. And you can find that link in the resources section in the tab on your screen. Okay, and it looks like folks are filling out the survey. And again, the question is, what types of bills addressing vaccines for children have been introduced in your state over the last year? And your options relate to adding or removing exemptions, adjusting how exemptions are implemented, increasing provider capacity to provide vaccines, improving data collection capacity, other, or none. Okay. All right. Thank you for responding to that. It looks like actually most are seeing none. Oh, the poll may have disappeared. Okay. Not sure that it was up long enough. Okay, well, thank you for those of you who were able to fill out the poll. That was just, again, a teaser for our next presenter. And our next presenter is Eric Skinner, a policy associate in NCSL's health program. Eric specializes in immunizations, oral health, and women's health. Eric will provide an overview of the state legislative actions that we've seen over the last couple of years related to immunizations. I will hand it over to Eric.
Great, thank you, Tara, and hello, everyone. Today, I will be walking through the major bills related to childhood vaccination from the last year or so. So I'll start with the category that we've all seen in the news and we all know about, exemptions for school-required vaccines. The bills on this slide removed exemptions either for religious or philosophical reasons. There is peer-reviewed scientific data to suggest removing exemptions supports safe levels of childhood vaccination. However, as you all likely know, these can be controversial bills, so we don't want anyone to walk away thinking it is the only way to support safe levels of child immunization against vaccine-preventable disease. And you'll see in the last year or so, we saw 3 bills remove religious or philosophical exemptions for school vaccination requirements. New York removed the religious exemption, Washington removed the personal belief exemption, and Maine removed both. So not all exemption bills remove or add exemptions. You'll see here that the Colorado General Assembly recently passed Senate Bill 163, which creates a standardized form as opposed to parents submitting handwritten notes to their child's school. That bill was sent to the governor on June 19th, and as of about 10 minutes ago, it looks like it is still awaiting the governor's signature. And here's just a kind of a national snapshot to just show you where the other states are at on this issue. The next type of legislation we'll review is vaccine administration and access laws. One takeaway here is that even before the pandemic brought on a serious drop in childhood vaccination rates, states were making concerted efforts to increase the number of providers authorized to administer vaccines. And there are resources states can take advantage of here. CDC offers education and vaccine administration training programs for physicians, nurses, health educators, pharmacists, and other health professionals. These two bills pertain to pharmacists and the administration of vaccines, but many provider types are authorized to vaccinate. This is just what we have been seeing recently. And we can see that Florida authorized pharmacists to administer the influenza vaccine to children 7 and older under a physician protocol. And Hawaii clarified pharmacists' ability to administer vaccines and added documentation requirements. So states create specific age and provider requirements, but they can also defer to federal agencies like CDC for their vaccine recommendations. I have examples of that language from West Virginia and North Carolina. Both states aligned their authorizations with CDC guidelines for vaccine recommendations, and I'll get a little more into that federal alignment on the next slide. And here it is. We have a couple bills that align state policy with federal law or guidance. In these cases, the federal pieces we're talking about are the Affordable Care Act and CDC's guidance developed and published by the Advisory Committee on Immunization Practices, or ACIP, which is a CDC body that develops recommendations adopted by most states for school-required vaccines, but as well as other vaccine recommendations for adults. We have heard discussions about how aligning state vaccine requirements or guidance with CDC or federal legislation may apply to an eventual COVID-19 vaccine. I just want to reiterate that these guidelines may impact that distribution. This will not be clear until we know precisely how that vaccine is rolled out on the federal level. So this is something that we are following closely and really thinking about, but cannot answer exactly what that'll look like definitively at this point. Another thing I would like to point out here is the variability I kind of alluded to in age limitations and vaccines that states authorize pharmacists and other providers to administer. So I think this map captures that. A little more than half of states allow pharmacists to provide vaccines to any age group, so long as the vaccine is recommended by CDC or meets some other state criteria. But states can also go a la carte for pharmacists or other vaccine providers, as I said before, and choose specific vaccines for specific age groups. And I thought I'd end my time today with legislation that we do know addresses a COVID-19 vaccine. These bills address the payment, distribution, and administration of a eventual COVID-19 vaccine. Although we do not know how the vaccine will be distributed or administered, states have begun to prepare by identifying traditional vaccine programs, tools, and levers like Medicaid, and in the case of Maryland here, standing orders and Board of Pharmacy regulation, as in the case of North Carolina, or anticipating potential documentation issues with immunizing pharmacists in the case of Minnesota. And as a side note here, NCSL is aware of 9 executive orders that require insurers to cover the cost of a future COVID-19 vaccine. So that is my time. Please reach out to me if you have any questions about this legislation or childhood vaccination in general. Here's my contact information. And again, I'd be happy to provide more legislative examples on this or any other vaccination issue. That'll do it for me here in Denver. Now we're going to take you back to Wheat Ridge, Colorado, and Tara Johnson, who will keep this webinar moving. Thank you.
Great. Thank you, Eric, for that great presentation. I want to address, we had several folks let us know that they were unable to answer the poll because we didn't put it up quite long enough. So I want to thank you for letting us know that. I also want to remind everyone that the presentations are available in the resources section. Again, there's a tab towards the top of your screen that says resources, and you will find a PDF version of all of the presentations that were shared today. We have several questions that have come through the Q&A box, and I want to encourage folks to please ask questions. We have some national experts here, and they are excited to answer your questions. So please don't hesitate to type a question into the Q&A box. I will kick it off with one of the questions that came in here. This question, I think, is for Dr. Wharton. Dr. Wharton, if the current immunization rates hold or continue to decrease, what might be the impact as the school year approaches?
Yeah, thanks for that question. Clearly, we'd be very concerned if we end up with lower coverage when school starts. We know that diseases like measles can be transmitted in schools, and so we'd be concerned about having outbreaks. Fortunately, although the reductions we've seen are pretty dramatic, they also have not been over a long period of time. So we're hopeful that we can get caught up relatively quickly and be in good shape for back to school. So that's what we're trying to keep all the kids safe by getting them vaccinated before school starts.
Great, thank you, Dr. Wharton. I think this question is for Claire. Claire, were any of the examples that you shared in partnership with the legislature? And if not, could you share an example of where I believe immunization managers and legislators have worked together?
That is a really good question. I don't know if any of those samples were working with the legislature. I do know that most of them were in collaboration with the AAP and the coalition. I'm trying to think of, I know that several of the efforts around the legislation that Eric spoke about were done in collaboration between the health agency and the legislature. I know that Washington State and Maine and New York, those health agencies provided a lot of information and impact study and worked with those legislators. So I think around legislation and changes to policies and regulations, there's a lot of collaboration. The communication campaign, I think that they were working with coalitions and AAP.
Excellent, thank you so much. Our next question, I'll pitch to Eric, but Claire and Dr. Wharton, you're also welcome to chime in here. Eric, how can the legislature address gathering childhood immunization data?
Great, thank you. I would say that what I've seen around this issue, I've seen resolutions and bills that ask the Department of Health to provide data, to just send it. Some states have developed task forces to study the issue and provide recommendations, and many times this is just what I've seen. I don't know if any of the legislation that I had in my presentation would have this sort of language, but I could certainly find it where the committee or the legislature asks the department to provide data, and so, the guidance on that can vary. It can just say we want kind of the state of the union on child immunization in our state, or it could be responding to something specific, and maybe a specific county or a school district that they'd just like to investigate and find out what the numbers and what the data say. But that would probably I would just say that's kind of often the first step in identifying what the problem is and finding a solution. But those are my reactions.
Kara, this is Melinda Wharton. Can I add something to that?
Absolutely.
As Claire mentioned, immunization information systems or vaccine registries are really important for public health, and they also provide important support to families for things like getting their child's vaccination record before they start school or before they head off to summer camp. and if they change doctors, so that that information is readily available and they don't have to track records down from other places. So they're really important for both public health as well as for families. And the IISs we have in the United States have been developed incrementally over a very long period of time with sort of separate decision-making and policy processes in different states. So in some states, there are laws or regulations that limit what IISs can do in the state. And so I think in order to really make sure that public health and healthcare providers and families have access to the best quality data about vaccines in their state, one place to start would be to talk to your health department or the immunization program within your health department about what are the challenges they're seeing with their immunization information system, and to see if there are potential solutions that are available.
This is Claire. I would just strongly agree with Dr. Wharton. There are states that have different policies around IIS, and some of them have had more success in getting quality data than others. So talk with your health agency. And also expectations around COVID-19 data. States are really preparing now. So if there are certain expectations for wanting data, I would speak now with them. But I think the IIS are so critical, and getting policies that allow for the best quality data to be collected from providers and patients is very important.
Excellent. Thank you so much. We are just at time now, so I did see a couple more questions just come in, and we'll make sure to respond to those by email following this webinar. I'd like to thank our presenters again for sharing their time and expertise on today's webinar. I would also like to point out that the additional resources, which you can find under the resource tab, are available for download. They will also be on our webpage with the recording of this webinar by the end of the week. So we'll make sure that everyone who has participated will get a link to that. So stay tuned for an email from NCSL to make sure that you can access all of the resources that we have available today. In addition to the national guidance and resources, you can find NCSL's most recent publications, again, including the COVID-19 legislative tracking database, which as of today includes over 2,000 bills introduced in state legislatures related to COVID-19. In the next few days, we'll have everything on our webpage, and this concludes our webinar for today. So thank you so much for your participation today, and stay well.